So let me go to panel number 4. First, I should point out that this big tent that we have people like all the people you heard earlier to work together, which is just great. So the final panel is called Resilient Climate Health Communities, Climate-Proving Healthcare at Community Level. Really important issue. And of course, we all talked about equity and many such issues. And facilitating the panel will be Dr. Maureen Lichtveld. She is the Dean of School of Public Health and the Jonas Salk Chair in Population Health, Professor of Environmental and Occupational Health, University of Pittsburgh. Also, she's a member of the National Academy of Medicine and the Leadership Governing Council. And over 35 years, she really has been expert in environmental public health area. Maureen.
So here is the way I'm going to wake you up. I demand, you've heard it, I demand that the 2025 summit begins with the community panel, not ends with the community panel. You know, as I was sitting here listening to each of the fantastic presentations, it occurred to me at some point that we might not need this panel because every one of the speakers brought up the importance of addressing vulnerable populations. So we had the why addressed. There was a lot of what's that came out, what it is people are doing. But this panel is about the so what. So what if all that happens? What does it mean for people on the front line? You know, when you get to a panel like this at the end of the day, you say, well, saving the best for last. That's certainly true. And then you also say where the rubber meets the road. But we in climate and health doesn't want more rubber to meet the road. So what we want is more investment to be made. What we want is more data to be available to predict so that we can prevent and prepare. Those 3 Ps, that's what we want. And so here to take you to that front line are 3 of my colleagues and leaders, beginning with Jessica Hinshaw, and Jessica will take us to the front line of community health centers. She's the Director of Environmental Health in the Population Health Division at the National Association of Community Health Centers. She will be followed by a person who's no stranger to us in this world of equity and environmental justice and now climate justice, Dr. Sacoby Wilson, who is the professor in the Department of Global Environmental Health Sciences at the School of Public Health in Maryland. And then to take us to the front line in the South, where I've lived for many years, Nathaniel Smith, who's the founder and chief equity officer of the Atlanta-based Southern Equity. And to take us to the floor of the House, President Tsao, of our Climate and Health Grand Challenge is Funmi Chinekezi, and Funmi will tell us what really is holding this whole Grand Challenge up, and that's the Climate Communities Network. I also am very proud to say that, until Monday, when we talked about universities and we talked about the University of Pittsburgh, I was a little timid. No longer do I have to be timid because over 7,000 faculty in all of the 6 health sciences schools at the University of Pittsburgh and the UPMC Health Center have created the Office of Sustainability, and my colleagues are here. Thank you. So, Jessica, take us there.
Can you guys hear me okay? All right. So yes, hi, and thank you so much for that introduction. I loved how you framed it, that we're going to be talking about the so what. I think that is so important because, as we know, operationalizing these things can be pretty tough. So big thank you to the National Academy of Medicine, Kaiser Permanente, and Climate Group for hosting this amazing event today. and I will just go ahead and get started, and hopefully, great. So this first slide that I have up here is just an overview on what are community health centers. So those of you sitting here today may not be as familiar with the term community health centers. You might be more familiar with the term federally qualified health centers, but that's the group that we're working with. So federally qualified health centers, community health centers, are nonprofit, patient-governed organizations. They provide primary, behavioral, and dental health services to 31.5 million patients each year. They're the largest network of safety net primary care providers in our country. They work in all 50 states and territories. And as you can see here, the populations that they provide health care to are the ones that are hit first and worst by a change in climate. They serve disproportionately the populations that are low income, communities of color, those that are located in rural areas. So this is just a really important group to be engaging in climate conversations because of the patient populations that they work with. So I really wanted to start with an example. There are so many amazing examples of community health centers who are building resilience to climate change in their own communities. I don't know if Dr. Jerry Abraham is still here. If he is, oh yeah, you're at the back. Please go talk to him after the end of the session because he should really be up here giving the speech and not me. But he's doing amazing work in his community health center, and there's just so many to choose from. But I wanted to highlight this one. That is Crescent Care Community Health Center in New Orleans, Louisiana. So, and this bridges on a topic that was talked about earlier today. How do we cope with loss? And I think this is a really good example of taking a loss and turning it into action. So in the aftermath of Hurricane Ida a few years ago, 19 residents of New Orleans died from the after effects of a hurricane, which was excessive heat exposure, lack of oxygen, or carbon monoxide poisoning. So because of this experience, there was a really amazing initiative that came together through the Together New Orleans Coalition, and they formed the Community Lighthouse Initiative. So this is a collaborative network of nonprofit resilience hubs that have installed commercial scale solar and storage systems with backup battery capacity. And so what their goal is basically everyone in the city of New Orleans, Louisiana, will be within a walking distance to one of these community lighthouses, which is a resilience hub, so that they can get access to cooling if they need it, get access to food and other resources that they need in a time of a power outage or climate-fueled weather event. And so beyond this, right, this itself is very transformative. But beyond this, because, and I forgot to mention, in this network, not only is there a health center included, but there are faith-based organizations, community-based organizations, a whole slew of nonprofits that are a part. And because all of them have commercial scale solar and storage now installed on their buildings, they actually went to the local legislature or the local governing body of New Orleans, and they applied for a rule change where now they can sell the power that they're generating off these solar and storage systems back to low-income residents of the community. So now those folks can get access to, less costly energy, electricity, which is just incredible. And so, we are really using this example of the Community Lighthouse Initiative as a North Star for our work at the National Association of Community Health Centers. So we are imagining a world where every community health center could install solar panels and backup batteries. What would that look like? And so I'm not going to go through all these numbers up here because there's a lot of them, but basically kind of four main takeaways are, and someone has already spoken to this today, is one, if health centers had solar panels and backup battery systems, they could continue their operations in the time of power outages. That's the big one. They can continue seeing those patients who need their care the most. The second one is they will avoid financial losses. So in the example of Crescent Care, during that hurricane, they had to shut down, and they had immense financial losses from that shutdown, from patients not coming into their clinics. They also lost a lot of medications because their refrigeration system failed. And so not only was this a cost to the health center, but also a lot of the vaccines that they had were from the state. So the costs expand beyond just the health center. So by installing solar panels and backup battery systems, they can avoid these types of financial losses. In addition, by installing these systems, they have energy savings, and those are only increased by the amazing incentives that are within the Inflation Reduction Act. And then finally, which is really important to all of us here, health centers can, offset tons and tons of carbon emissions by installing these systems at their health centers. So to operationalize this, and speaking to wonderful partnerships, my organization, along with some amazing partners, Capital Link and Collective Energy, have formed the Community Health Access to Resilient Green Energy Partnership, or the CHARGE partnership. And so basically what we're doing is trying to provide turnkey solutions for community health centers to be able to install solar microgrids at their facilities. So we have a partner, Capital Link, that's really working on a capital stack of funding to get that to health centers so that they can install, have the funding to be able to go for this. We have Collective Energy, who is our partner who specializes in designing and installing and permitting solar and storage solutions. And then we have ourselves, the National Association of Community Health Centers, and we are engaged in educating about this opportunity. And Dr. Balbus mentioned this earlier, but we very fortunately were able to apply for an award through the Department of Energy for $57 million. And so we're in those award negotiations right now, but we would be able to provide solar and storage systems to community health centers throughout the rural Southeast. And not only is this award related to solar and storage systems, but there's also a workforce component. So we're also going to have health centers partnering with local community colleges, local workforce organizations and installers to really build up the workforce for clean energy. I'm not going to get into this, but again, there's amazing initiatives going on at community health centers, which you can read about here. Some of them include nature-based solutions, which were mentioned earlier, which I think is phenomenal. And then our organization is very fortunate to partner with many people here in the room, like Eco America and the Medical Society Consortium on Climate and Health and CDC. So just want to highlight again the importance of partnership. And with that, I'll turn it over to the next speaker.
Awesome. Dr. Wilson.
Hitting the room. It's all green. Happy Earth Week. It's all the green. So I'm happy to be here as well, and thank you to the academies for the invite. For me, when you think about this conversation, I do a lot of work, as was mentioned, on the front line with frontline fence line groups. So I think when we think about the issues of climate change, how are we making sure, and I'm going to talk about some funding issues too, but how can we make sure those are the front line of climate change or the front line when it comes to the money? That's really important. So we have the Justice 40 framework, President Biden's Executive Order 14008, as we move from a dirty energy economy to clean energy economy, 40% of the benefits of federal investment should go to disadvantaged communities. Disadvantaged, that framing is maybe problematic, but you get the point. Now, part of that problem with that framing is we're talking about the benefits. I always use a quip, for those of you who remember chemistry, stoichiometry, inputs and outputs. They need the money and the benefits, right? Because you just have, amorphous benefits, that's problematic, right? So you need to make sure the dollars are going to those communities that you identify, prioritize, and micro-target. And the best way to do that is work with communities that are already doing the work. So you have in the environmental justice movement, you have decades and decades of experience of groups who've been doing this work, right? You have the Environmental Justice Leadership Initiative on Climate Change. You have We Got for Environmental Justice, which is one of the oldest EJ groups in the country. They have a DC policy office, right? You also have the Climate Justice Alliance. You have state networks across the country that are working on climate and environmental justice issues. Of course, California has a EJ network. There's now a new network in Michigan, the Michigan Environmental Justice Coalition. I think that's the right acronym. You have the South Carolina EJ network. One of the oldest state-level EJ networks is the North Carolina EJ network. That's where I was raised up in the EJ movement by Gary Grant, Naima Muhammad, Dr. Steve Wing, who's no longer with us. So You have multiple groups like that that should be, if you're going to do this work well in partnership, partner with those coalitions that already exist. Partner with those networks that are already in place. Of course, we have New York, New Jersey EJ Alliance. You have New York EJ Alliance. You also have a Chicago area environmental justice movement as well. You have a Midwest Environmental Justice Network. I'm trying to name all the networks. I don't know all of them off the top of my head, but you can go to there's sites, and of course, you have the National Black Environmental Justice Network. It's more national, of course. So, and then you go to different parts of the region. You do have these networks. I think that's for me, that's a one-stop shop. If you really want to work with the folks who are there doing the work, who are already anchor institutions, right? Who are trusted. That's a place to start. Now, in my own work, I direct the Center for Community Engagement, Environmental Justice and Health. We do a lot of work collaborating with environmental justice groups, climate justice groups in the Mid-Atlantic region. So one of the coalitions I did not mention is called the Mid-Atlantic Justice Coalition. I like the quip. I came up with the name. People didn't like it initially, but it's MAGIC, right? Y'all can remember that, MAGIC. And so MAGIC covers Delaware, D.C., Pennsylvania, Delaware, D.C., Maryland, Virginia. You want to get to Pennsylvania. You haven't gotten to Pennsylvania yet. But that coalition includes grassroots groups, advocacy groups, green groups working together. And part of the work that we've done with that coalition is really, again, providing technical assistance and consultation to them on these issues. Now, as it relates to funded hubs, I think hubs are a really good approach. So we heard about some health care-related hubs. I'm funded by the Robert Wood Johnson Foundation, something called the Mid-Atlantic Climate Action Hub. So you hear Mid-Atlantic again, that's a theme. The acronym, again, is MATCH. People love the acronyms we come up with. So MATCH includes community-based organizations in D.C., Maryland, Virginia, Delaware, also New Jersey, and Pennsylvania. So we have grassroots EJ climate justice groups who are acting as hubs in that geographic area of coverage. So, for example, in New Jersey, we have Kim Gaddis' group, SWEA, Southward Environmental Alliance. In Philadelphia, we have the Overbrooks Educational Center, run by Jerome Shabazz. When you go to South Baltimore, those of you know about Curtis Bay or that port of Baltimore, you saw the ship, the Key Bridge, they work in that area, that part of Baltimore. You have South Baltimore Community Land Trust. They also have the largest medical waste incinerator, talking about these issues of healthcare. Some of your medical waste is going to that incinerator, right, in that community. And they're a quintessential EJ community in the state. You go to southern Delaware in the Eastern Shore, we have Centers of Eastern Shore Health and Texas Environmental Health Network. Those are two groups that work on industrial chicken farms, biogas. You think about all those issues, right? You go to D.C., we have Empower D.C. They do a lot of work around housing and gentrification. Then you go into Virginia, you have UPAL, United Parents Against Lead. They actually have, the 30th is Community Resiliency Day. I think they have one of the first community-based solar hubs in Virginia. So that's UPAL. So those are hubs that we have as part of MATCH. And MATCH is funded by both Robert Wood Johnson Foundation and also forgot to say the Waverly Street Foundation. So Waverly Street Foundation has done a lot of work in funding hubs, climate action hubs at institutions that serve the MSIs, I just say the acronym. So historically black colleges, tribal colleges, also Hispanic serving institutions. So you have one in the city of New York. You have one you have Gulf Coast. Dr. Wright has a hub. You also have a hub at Texas Southern, led by Dr. Bullard. You have a hub at another HBCU, Historically Black College University. Just say Dr. Malt for everybody. At FAMU. So you have multiple hubs at HBCUs, tribal colleges, and also, as I said, Hispanic serving institutions. So that is an approach, I believe, that could be replicated. So how can you in this room who already have hubs or are talking about climate resilience, how can you engage with those hubs that are part of this Waverly Street family or the Robert Wood Johnson family, right? Now, additionally, another set of resources as it relates to infrastructure that's out there you connect to, and some of you are already probably connected to it, is the work that Kresge Foundation is doing, that Climate Change Health Equity Program. That's in many ways, that's a sister program to this program. So they've been funding collaboratives between healthcare institutions and communities. So I think there's a lot of really good infrastructure out there that we can connect to, but I think what's important to come back to community. Community should be leading us. You know, I like to always say, you may not believe in climate change. You do believe in it, but just let me say it. You may not believe in climate change, but climate change believes in you if you're poor, if you're black, if you're Latino, right? If you're Native American, if you live in a floodplain, if you don't have health care, if you've been marginalized, if you've been invisibilized. So how do we empower those communities? How do we work with those communities to make sure they're at the front line? Now, getting back to the money again, one program, and I think I mentioned this maybe the last time I talked here, there is a community change grant opportunity. So the EPA has a community change grant opportunity, $2 billion that's available right now. That community change grant has track 1 and track 2 funding. Track 1, about 150 grants, about $10 to $20 million, on track 2, I think 10. That is really about climate action. But you have to put community first. They have to be community-led. So for those of you who are already in this space who really want to focus on equity, and you can't have equity without justice, y'all. So I know we're talking about equity, but if you don't have a justice-centered, justice-focused approach, you're going to basically replicate some of the systems that we already have. An unjust system can't get us justice. So if you're going to get the climate justice, we have to make sure community is first. So that opportunity, that climate change funding opportunity is a good opportunity. And I'll just say this and pass the mic, 'cause I know over time. We also applied for the $75 million NOAA Climate Resilience Challenge funds. So hopefully, with the funding that we received from Robert Wood Johnson and also from Waverly Street, and I'll say this, I know I'm over time again. I'm also the co-director of the Region 3 TICTAC, the US EPA's Driving Community Technical Assistance Center. So those of you in the room, you should be trying to engage with these hubs, engage with your regional TICTAC, and also there's another pot of funding, the EPA grant makers. Engage with the newly funded grant makers. That's infrastructure that we can be building these really resilient hubs, but you have to have money, and that money has to focus on the people who are most impacted. Okay, I'll pass the mic back. Thank you.
And speaking about equity way down south, Nathaniel, get us there.
So again, thank you for the faithful few that have stuck around and provided an opportunity for us to share the work that we're doing. I'm also, Dr. Wilson, really excited about you really lifting up the various organizations that need to be involved in the process. For me, even though, of course, the Partnership for Southern Equity is focused on realizing what we call a new Southern agenda for racial equity and shared prosperity, we also have a great opportunity to do a lot of great work around the country and now globally. And so my focus in my talk and the time that I have is not to just talk about the what, but to talk about the way. What is the way of doing the work that will realize the type of change that we want to accomplish collectively? And I have a short amount of time, and if you know anything about a Southerner, it takes 30 minutes for us to clear our throat, let alone make the case for what is important. But I will do the best I can. And so the first thing that I want to share with you is that if we want to realize a climate and health agenda, we also have to be just as committed to realizing a repair and healing agenda. We've heard a lot about the importance of a competitive advantage. And some things, yeah, you can put that within that context, but we also have to understand that the greatest difference between equity and equality is history. And that there are many organizations and communities that have been harmed by the history of extreme extraction and also the challenges that we face around structural racism. At the Partnership for Southern Equity, we believe that racism is a social determinant of health. And if you don't undo racism, then we will not be able to create a healthy society. And so we have to be able to fight that head on. So as you think about this agenda as it relates to climate and health, also think about how are you leveraging this opportunity to repair communities and to make communities more healthy versus just the challenges that we face around climate and health and what we have to do. So there's an urgency there. And so I want to talk a little bit about some of the work that we've had an opportunity to do. The first thing is, and I'm glad that you lifted up the Justice 40 Executive Order. We had an opportunity as an organization to focus on that particular issue and work with 4 organizations, the Solutions Project, Elevate Energy, Hummingbird, and other partners, Groundswell, to realize something called the Justice 40 Accelerator, where we had an opportunity now in our 3rd cohort to work with over 101 organizations around the country, provide money in pre-development dollars as well as technical assistance And as a result of that, we provided navigators because we also acknowledge the history of racism in procurement and contracting. It's not just about the resource, it's about how do organizations have access to that. So quickly, so far, we've had an opportunity to draw down close to $46 million as a result of the accelerator. And provide resources to various organizations on the front lines that are doing this work. We've also had an opportunity to stand up a $2 million revolving loan fund that we're utilizing to support frontline organizations as they wait on federal dollars. So again, it's not just about positioning people to get the resources, but it's about understanding the dysfunction of the delivery systems that we have to depend on, and also position people on the front lines, on the front lines to be successful. The second example that I want to lift up is something that we're initiating called Just Communities. So if we want to change our circumstances, we have to be willing to change the rules. And one of the key opportunities to do that is through credentialing. And so we actually had an opportunity to acquire a global organization called Eco Districts a couple of years ago and actually reimagine the credentialing process in ways that would center people at the center of this conversation around resilience and sustainability. So we have developed an accredited professionals program through the history of eco districts, as well as now selecting various communities to be our first just communities. So far, in the past 2 months, we've been able to provide credentials to over 100 individuals through our AP program around the world. And we've just selected 4 communities in Georgia where we'll be providing $100,000 in pre-development resources as well as $70,000 in technical assistance. Our hope is to move forward and make the Just Communities protocol and the work around Just Communities similar to what eco districts help to advance global work, and with embedded in that will be a health impact assessment as we work with our Just communities in various places around the world. The last thing I wanted to talk about was another initiative that we're doing in the state of Georgia called the Southern Environmental Health Initiative, where 2 of our portfolios, our Just Energy portfolio and our Just Health portfolio, are beginning to collaborate, right, on thinking about strategies that will amplify the good work that is happening around environmental justice in the state of Georgia, begin to work to really cultivate the agency of organizations on the front line to fight for their values to be included in policy making, and also to begin the process of strengthening the civic ecosystem that is in the state of Georgia, and align that ecosystem in ways that will bring about structural change. So for us, we've been doing this work, and it's been very exciting as it relates to the work that we're doing. We also, of course, through the support of CREXI, have a CCHE effort that we're doing in the city of Atlanta, where we're working in 6 zip codes in West Atlanta to do a lot of the things that we've been talking about. And so in a short amount of time, I just wanted to say a couple of things, and I'm done. We have to believe that the people that are closest to the problem are actually closest to the solutions. We have to put them at the center of change making, that it's not about doing something to anybody, but doing it with people, right? We have to work to do the work collaboratively with the people on the front lines and believe in our hearts that they have a part of the solution, that their genius has to be incorporated in the decision making and the policy making that we're doing as organizations. 2, we got to give them money, right? You know, we can't expect for the various organizations on the front lines to change injustice with $5 or expect for them to do that in a grant cycle. It took 400 years for us to get here. It's going to take 400 years for us to undo the history of structural injustice that we're facing in communities. And 3, we have to move beyond, and some people are going to disagree with me on this, but I'm tired of talking about the competitive advantage, right? We know that there's an economic imperative associated with climate and health discussions, but there's also a moral imperative. And dollars mean nothing if we're all dead.
Yes, sir.
It means nothing. So we have to get back to basics and work to ensure that all people are looked at as precious and all people are positioned to reach their full potential, that we connect the health of our planet to the health of our most vulnerable, and through that we'll be able to create a better tomorrow that's not only competitive but also just.
Yes, sir.
So I'll leave it at that. Thank you.
So our grand challenge is exactly about what Nathaniel talked about co-creation and co-implementation And so if you could send that through when Funmi is going to talk about the foundation of our grand challenge at the National Academy of Medicine.
Thank you so much. I hope you all can hear me okay. And I just want to thank my fellow panelists and colleagues for those remarks. And I will jump right into it. So hi, everyone. My name is Funmi Chinekezi. I'm a program officer with the National Academy of Medicine, supporting our Climate Grand Challenge and specifically leading our Climate Communities Network. So as my fellow colleagues have shared, it's no secret that traditionally marginalized communities exist due to a number of systemic issues. But what's worse is that these same communities are also often excluded and overlooked when it comes to the decisions that directly impact their quality of life. We know that this is true for climate change and health, especially with all of the related disparities that are on the rise that we've heard about today. With the CCN, we want to not only make sure that communities most affected by climate change are heard far and wide, but also that their voices are a key driver for solutions. We know that it is their expertise and lived experiences that will inspire positive and sustainable change. So this slide just gives an overview of our program structure. I did want to share that as part of our approach for the CCN, we are actively learning both from and with frontline communities with the goal of amplifying and sparking community-informed action to address climate-related health inequities. The CCN has a unique structure in that it involves 3 primary groups, which are detailed in the slide as co-developers, and these groups include CCN members, CCN strategic partners, as well as the NAM. CCN members are community leaders working for community-based organizations, and importantly, these individuals serve as liaisons to the community as well as the organizations that they work for. They also work collaboratively within the network to advance their community's priorities. CCN strategic partners are a mix of governmental and non-governmental organizations that provide specialized support and resources to further the priorities of members. The NAM facilitates this relationship by co-creating opportunities for members and strategic partners to come together, to convene regularly, to increase the visibility of their work, which we know is really, really critical, and inform climate-related interventions. So how did we get here? In launching the CCN, it was really, really important to us to be data-driven in our approach. So what you see at the top right corner of the slide is a map reflecting the composite environmental justice scores across the contiguous U.S. This score was actually developed by Dr. Wilson's team at the University of Maryland, so shout out, shout out there. We appreciate it. But this score reflects the disproportionate impacts of climate hazards and related inequities at multiple geographic levels down to the census tract level. It also combines data across key domains, including socioeconomic and environmental justice indicators. And it also provides data on the upstream drivers of climate change, as well as mitigating and resilience factors. So the numeric score ranges from 0.0 to 1, but essentially the deeper the red, the more highly impacted a community is. Along with other criteria, we also used census tract level CEJ scores to guide our review and selection of applications to the CCN. So all 18 of the organizations that were selected to join the CCN are located in areas with high CEJ scores. And this is reflected in the map directly below the CEJ score map. And just wanted to highlight that our CCN members come from 10 states as well as Puerto Rico. And you can see the states as well as the organizations listed in the map. Our CCN members and their organizations are focused on priorities such as extreme heat, flooding and sea level rise, air and water quality, green space equity, and mental health. And importantly, 15 of our 18 members are working with youth through their initiatives as well. Together, the network will tackle critical impact areas, including funding, policy, research and data, capacity building, and youth engagement. the goal is really to promote change at multiple levels, including the local, regional, and national level. This will also include the development of community action plans. Ultimately, we really would just want to learn from what's happening on the ground, identify and facilitate connections, and ultimately advance innovation, innovative solutions that catalyze change. It's one of my favorite slides. So this is our CCN outlook. During our first few years, we have a number of things that we want to accomplish, but importantly, we will be rallying around shared priorities and working collectively to tackle common themes across issues such as air quality and regional clusters and through learning collaboratives. We also plan to deepen our work with and formally integrate youth into the network, particularly through a citizen science project that will facilitate data collection for various climate interventions. We plan to continue to elevate our members' work and actually just launched a new resource that's available publicly on our website, and this photographically depicts and categorizes our members' priorities through an interactive map. So in case you haven't seen it, this is a shameless plug. But the tool really just allows the public to have a better understanding of what community leaders across the country see as their priorities and what they see as the most important and climate and health challenges in their communities. It also highlights the layered diversity across our CCN membership. So you can see the different types of organizations that are represented, as well as their different strengths, their different experiences, and so on and so forth. Overall, we are really excited about the future of this program, and we believe that the CCN is uniquely and well-positioned to make a difference at the intersection of climate change, human health, and equity. This is for a number of reasons. So first, I just want to share that through the CCN, we see ourselves as strengthening and bridging the gap that so often exists between local and national efforts. The local community action plans that we are working on, combined with our regional alignment and our national reach, really creates powerful momentum for change. Additionally, our program structure was intentionally designed to create this sort of equal three-way relationship that gives birth to new partnerships and makes it so that local communities have direct or easier access to decision makers and resources. And last but not least, we know that communities are distinct and there is not a one-size-fits-all. And so working together with local communities to address both specific and common climate and health challenges across the country really allows for consensus building around promising practices and increases the likelihood for scalable change. As the CCN grows, we're going to continue to promote multi-sectoral and multi-directional learning, and we also plan to conduct a formal evaluation of our efforts just so that we can track on our short and long-term impact. And so I would like to think that the future of CCN is really bright. But with that, I would like to present to you our Climate Communities Network. So you can see our 18 members as well as our strategic partners on the slide. This diverse group of individuals is really the foundation of CCN. We obviously cannot do any of our work without them, and it's just been an amazing journey so far. So I do want to publicly acknowledge and thank them, and we actually have a number of our CCN members and strategic partners in the room. So shout out to you all. It's so great to have you with us. And sorry, one more.
We have time, we're over time, but we have time for one question in the room and one question online. So question in the room first. There is a hand up here. Can we get the microphone? Yes, go ahead.
Does this work? Can you hear me? Great.
Yes.
Hey, folks. I'm Julian McCrone with the Community Development Team at the Federal Reserve Bank of New York, and I'm going to ask a predictably on-brand money question. For Jessica, wondering, I think that slide was really compelling about the benefits you quantified of the potential system retrofits, wondering if there was a price out attached to that. And then for Nathaniel and Sacoby, I think it's obviously there's a lot of excitement around the philanthropic and federal funding opportunities on the table. Wondering what your asks would be and what you think the EJ community is needing from other sources of finance to help get projects off the ground. And that could be either from large or local financial institutions or say health payers and health systems who may also have capital contribute to solutions. So thanks for that.
So Jessica first.
Sure, yeah. And I'm happy to follow up because I need to verify my sources because actually the team that does the solar installs came up with all those numbers and they based them on actual installations that they have done. So it's based off of real data. And we have done both retrofits, new installations, new builds. So I think it's an average of all of those, but let me look into that. But basically, the average cost of putting solar and storage on a community health center is about $350,000 to $400,000.
Thank you. Sacoby and Nathaniel?
Yeah, so I'll be quick. I won't get into specifically a number, but I will say that one of the challenges that we have is to get philanthropy to understand the importance of long-term infrastructure. There are many things that have been engineered right now to really leverage the work of around the Justice 40 executive order and other specific opportunities that need a long-term solution and long-term infrastructure. And one of the challenges that we're facing is that philanthropy by nature is very reactionary, right? And so how can we be proactive in ensuring that efforts like the Justice 40 Accelerator and other great efforts that are happening around the country are funded for the long haul and we don't continue to take a reactionary posture every time resources come around, that we'll have the infrastructure and the institutions in place to take advantage of these moments in time. And so I'll provide, so that's kind of my perspective on that.
Yeah, I think it's a really great question. So Community Reinvestment Act is another source of funding, right? We have through the Greenhouse Gas Reduction Fund, we have CDFIs that are going to be engaged solar for all. So you just saw the announcement about that. So that's an opportunity. I think when it comes to healthcare, community benefits agreements, y'all, got to find a way to make those more impactful. So I know some of the people who in your coverage area don't live in that immediate geographic impact of your footprint, but your community benefits agreement should include your footprint and your patient population and making sure you're bringing in those co-benefits back to those patient populations and the communities that are hosting your facilities or the communities that are hosting your waste stream, like the folks in Curtis Bay, right? So the benefits agreement geographically can be local, proximal, but also going to be distal too when it comes to your waste streams and your patient populations, right? And I had another point. I forgot to say, Central Day Employee Familiar was another one of my hubs. I get in trouble when I forget hubs. And then on the Tic Tac, we do have 3 HBCU partners. But I do think those supply chain benefits agreements are really important. Look at what the Department of Energy is trying to do. Bring some of that into this space. But again, the proximal groups and the distal groups, CBAs are where to go, but more innovation is needed in that space.
Quiz of all the acronyms that Sacoby mentioned.
Sorry, y'all.
Is there a question online? If there isn't a question online, I'd like to take the prerogative to end with where Nathaniel started us off and talk about repair. As a native, as a child of the Caribbean, I refuse to accept that because lower and middle income countries and poor communities are already set with these and they don't have the resources that we talked about, that we should settle for adaptation and not take mitigation as a true option. I refuse to accept that. And so I'm very pleased to say that as part of the NAM Grand Challenge, we will, in December, have a research innovation hub in the Caribbean, in Trinidad and Tobago, to talk about next steps, not only for research, but for implementation and repairing the kind of things that we have caused, we in the developed world have caused in lower and middle income countries and poor communities without the resources that are near to fix them. And so this is a challenge to keep you awake for the closing remarks and join us during the reception. Back to President Saul.